Okay, so welcome everybody to our self-compassion for chronic illness talk. I'm Ronya. I'm one of, I think we've got 3 official members on the team of Emerge ACT. So I'll be presenting on behalf of Emerge ACT, and we work in conjunction with Arthritis and Pain Support ACT as well. If you haven't met me, I do some of these extra courses for people who've got chronic illness. So a lot around fatigue and pain conditions like ME/CFS, long COVID, fibro, things like that. But I'm also occasionally on reception. So you might get an email from me or hear me over the phone, and sometimes at the pool as well. We like to share the roles around a bit here. So this presentation will go for about 40 minutes, and it will be recorded. Just housekeeping to protect your privacy, we ask that you mute during the presentation and save any of your questions until the end. We'll have a specific time for a discussion. 40 minutes is a long time to sit through and concentrate, so I'll keep an eye on the time. I've scheduled every 15 to 20 minutes there will be a 3-minute break, so that you can get up, do whatever you need to self-manage, even just close your eyes and reset. If you want to, feel free to write down any questions as we go in the chat function on Zoom so that you don't have to remember them throughout the whole presentation. And we'll go through the chat at the end too. And then we just ask during the discussion and the presentation that we all be respectful of other people. Okay. So just to give you a bit of an overview about what I'll be covering today, we'll start by figuring out what do we mean by self-compassion? What is it? Then we'll go into the benefits of self-compassion if we're able to be self-compassionate to ourselves, particularly when we've got a chronic illness. Why is self-compassion so hard and unintuitive when you've got a chronic illness? I'll talk about a few different strategies that you could use to cultivate self-compassion. At the end, I'll talk about some of our services that we have available for people who have got chronic illness, who are that can help you nurture your self-compassion and build that muscle. And then at the end, we'll have an opportunity for discussion. So what is self-compassion? Self-compassion is being kind to oneself during moments of pain or suffering, rather than being harshly self-critical. And I think sometimes it doesn't actually come supernaturally to us when we are in distress or in pain, to be kind to ourselves. You can think of it like treating yourself how you would treat a close loved one if they were experiencing illness, injury, or distress. And in a lot of the self-compassion literature, self-compassion can be broken into 3 different aspects. So the first is self-kindness. This is approaching yourself with kindness and not being judgmental of yourself in situations where you maybe are not meeting your expectations of yourself. Maybe you're not coping as well with the situation as you might expect, or you're not able to achieve something to the standard that you would like. So being kind to yourself in all those sorts of different situations and thinking of yourself as worthy of that kindness, which I think is something that we struggle with a little bit. The second is having an awareness of common humanity. And this means recognizing that you are human, and part of being human is making mistakes. But it also means acknowledging that part of being human is also enduring suffering. We experience a whole wide range of emotions and situations and pain and sadness and illness and worry. Those are all as normal an experience as joy and pleasure and fun and excitement. All of that is part of living. as a human. And the third and last aspect of self-compassion is mindfulness. So I think mindfulness has become a bit of a fad over the last decade or two. But what it really means is not, going on these extravagant wellness retreats or meditating every day for hours, but it's actually just noticing and appreciating the present moment. And also being aware that hardship and difficult emotions, like all emotions, don't last forever. So experiences and emotions will come and go, and we don't need to be completely caught up in that. We can have a bit of a mindful distance from those experiences. Self-compassion can be either body focused. So we might consider how we can approach our body with those three aspects of self-compassion. So kindness, awareness of common humanity, and mindfulness. And that might look like considering, like, how can I best support my body right now, even though I'm experiencing pain or fatigue or stiffness or nausea, whatever the sensations might be. And it might also be mind focused. So accepting my emotions and thoughts and behaviors, even when they're uncomfortable, and maybe taking steps to alleviate some of that discomfort in healthy ways. So it might look like allowing myself to take a break, engaging with friends or family, journaling some of my emotions if that's helpful, or making time for doing something nice for myself to lift my mood. So if you attended or you viewed my introduction to pacing talk from a couple of months ago, this slide might look familiar, but I'm just going to kind of go over it again briefly. So these three cups, let's think of your total day's energy as a cup of energy. And so these three cups represent three people's total energy and capacity for a day. So on the left, we've got a healthy, non-disabled person who has no chronic mental or physical health conditions. The person in the middle has a mild chronic illness, and the person on the right has a severe chronic illness. So the healthy person's cup is able to be filled with lots of different activities, with a little bit of room at the very top there, kind of left over for any emergency activities that come up that require energy. When we're dealing with a chronic illness, though, whether that be mild, moderate, or severe, the condition itself takes up a lot of space in that cup of energy. So this means often we're dealing with fewer activities in a day, but they take a greater toll on us. And often we might then also be experiencing a lot of pain or exhaustion. So having self-compassion when we have a chronic illness means acknowledging that the symptoms and management of our conditional conditions takes up a lot of space in that cup. And it also means being kind to ourselves when we're struggling with having such a small amount of space left over for everything else in life. But sometimes treating ourselves with kindness can be really hard. Some reasons it could be difficult to be self-compassionate when you have a chronic illness are shame and guilt. So you might not feel worthy of compassion. You might feel like you're a burden to other people if you have to rely on carers or pull out of plans at the last minute. You might be used to prioritizing other people's needs above your own. And this can be especially difficult if you've developed your chronic condition later in life, after having a role as a caregiver or a parent. And when we're no longer able to fulfill these roles to the same degree or the same level of expectations like we used to, we can tend to feel enormously guilty about it. So we might not feel worthy of self-compassion. Another reason could be feeling like you're stuck or trapped by your condition, or you might feel helpless because you have little control over your illness or symptoms. And an automatic response to this can be resentment or anger towards your body for failing you, or maybe towards the greater medical system for being unable to relieve your suffering, or even at yourself for not being tough enough to push through. Comparison with others. So again, a very natural and hardwired response. And this has come from, our prehistoric days, to compare ourselves, to compare how we're doing to other people in our circle, except now our circle is not just those close group of family or whatever, but it's also quite large, like international, because of technology like social media. So if we compare ourselves to who we were before we got sick or to other non-disabled people in our life, we can feel shameful or resentful for not being able to do the things that others can do. Well, sorry, I've still got sometimes it can be more helpful to compare ourselves to peers who have got the same conditions. But again, we tend to, when we compare ourselves with others, to put on rose-colored glasses. It seems like everybody else is coping or managing better than we are. Even the same condition can have a wide range of severity and impact. So someone may be able to work full time with the same condition that you have, and you are on, you're completely disabled, and you've had to go on medical retirement, for instance. So comparison doesn't help us to treat ourselves compassionately. Another reason that self-compassion is so hard is that our society expects us to be healthy. Apart from the occasional virus or injury, and that we should be productive and work hard and earn money. And that is our value. That's our contribution to our community. So when we get sick with a chronic illness, it can be really difficult to kind of shake those ingrained societal expectations of us and realize that we have worth outside of our ability to be productive and work. And we're not just dealing with the broader societal expectations, but we're also dealing with expectations from friends, family, acquaintances, even your healthcare team. So some people struggle to adjust their expectations of you because you might look the same, even though your capacity has changed. And even our doctors or our allied health team can put expectations on us to be the perfect patient, which is just not possible. That's that common humanity side of things again. So if we don't take our medications properly, or if we forget to do our exercises occasionally, we can be hard on ourselves and even blame ourselves for not getting better. And like I said before, we often have a love-hate relationship with our bodies once we become chronically ill. Sometimes we can experience a lot of anger or resentment towards it. And also the look of our body might change. When we get a chronic condition, we might put on weight, lose weight, the color of our skin, our pallor might change. And that can change our body image and self-esteem too. So if you're not feeling good about yourself, then it's really hard to treat yourself kindly. And then on top of everything, there's extra stress. There's lots of other stresses that come with being chronically ill, which means that we might not have as much emotional bandwidth for approaching ourselves with kindness. So that could be worries about finances or stressful relationships, all those sorts of things. So all in all, being self-compassionate can actually be really hard to do. Acknowledging that is the first step towards becoming more self-compassionate. But if we are able to be compassionate, there are lots of benefits, and these are just a few from the research. So the first one is that it can lower your mental distress, and that includes um, uh, better lower anxiety, stress, depression, loneliness, shame, all those sorts of things. And on the flip side, you might also experience more positive emotions. And people who are self-compassionate actually do more things to improve their health and look after their body. So that's an added benefit when we've got a chronic illness. You might get more life satisfaction, so generally feeling more happy with how your life is at the moment without wanting to change things too much. Um, you could feel more self-worth and autonomy, which means feeling more in control of your life. We're better able to cope with stressful times and bouts of poor health, which often happens with some of these conditions. So we kind of go through periods where things get a lot worse. And being self-compassionate means that we're more resilient to those ebbs and flows. We can get better at solving problems. There are lots of physiological changes that happen when you're self-compassionate, and that includes better immune regulation, immune functioning, having less cortisol, which is one of those stress hormones that if it's too elevated for too long, it can put you at risk of other chronic conditions like heart conditions. Um, higher heart rate variability, which means that your heart recovers better from stress, and your sleep quality and your sleep, being able to stay asleep will improve as well. You could feel more connected with other people in your life and improve your relationships, and that includes how satisfied you are with your romantic or spousal relationship. People with more self-compassion are more likely to help and support others, including volunteering. But also, in addition to that, they're also less likely to burn out from caregiver fatigue and emotional burnout. Okay, so we have reached 20 minutes. So we're going to have a 3-minute break. Come back at 10:24 and we'll continue with some tips on how to become more self-compassionate. Okay, we might get started again. All right. So now that we know the benefits of self-compassion and also why we might find it hard to be self-compassionate when we have chronic illness, let's talk about some practical tips for cultivating self-compassion. And the following few slides will give you quite a range of different strategies. Um, Self-compassion is like a muscle, so sometimes it's really helpful to kind of have a few different strategies, a few different exercises that you're engaging with regularly to build that self-compassion muscle. The first thing would be if you're finding changing that self-talk from being very self-critical a challenge. Sometimes the first thing to do would be to find a therapist or a counselor or a psychologist who you trust to help you work through some of those kind of more deep ingrained issues. There are a few different types of group or individual therapies that are more specific to improving self-compassion or aspects of self-compassion, like mindfulness. But a good therapist, counselor, psychologist will be able to tailor all of these different sorts of therapies to your specific situation. So some of the therapies, if you want to see if somebody has been trained in them, you can look these up. The first one is Mindful Self-Compassion, MSC, which is a standardized 8-week program, and it's often delivered in small groups. So that is actually specific to improving self-compassion. There's a therapy called compassion focused therapy, or CFT, which can be delivered as either a group program or an individual program, so one-on-one with a counselor. And also, I think many and probably most therapists nowadays are also trained in acceptance and commitment therapy, or ACT, which you might have heard of before. It's usually delivered as an individual therapy, but it can be delivered in a group setting, and it's based in mindfulness mostly. So different therapists will be trained in different types of therapy. So you might need to confirm with your chosen counselor or psychologist which ones they provide. We do have access to 2 counselors through Emerge ACT who are trained in mindfulness-based therapies. So if you need some guidance or you'd like some first steps, just get in touch and we can or arrange that for you. But therapy can be pricey, and it can be also pretty time and energy intensive. And finding a therapist that you connect with can take some time. So you can also implement some of your own tools, which might include loving kindness meditations, if anybody's tried that before. It's usually a guided meditation, so somebody will talk you through it, and often you can access this pre-recorded. You can find loving kindness meditations for free on YouTube and various other platforms as well. And those guided meditations focus on feelings of unconditional kindness directed either at others or towards yourself, or both. And it can be a really good way of practicing and strengthening that kindness muscle. If you are into journaling or letter writing, you can write yourself a letter where you are kind and accepting and forgiving of what you're going through. So that could be an actual practice where you sit down and you say, I'm going to write a letter to myself that's kind. Or another option could be to write yourself a letter when you're feeling good about yourself that you can then open and read when you're struggling. So in the same way, some people can find that regular journaling is a really helpful tool to acknowledge what you're going through. Any mindfulness practice has been shown to increase overall self-compassion. So if loving kindness meditations don't work for you, there are lots and lots of different types of other mindfulness meditations. So that could include breath work or relaxations like a body scan practice to work out which one feels good for you and works for you. We do have a free pre-recorded playlist of a range of these different techniques available for free for members. I can send you the link if you're interested. It's available on YouTube. So just let me know. Back to this aspect of common shared humanity, connecting with other people in the same boat is going to be really helpful. So going back to that issue of comparison, we have a lot of different support groups through Emerge ACT, full of people from a range of different backgrounds and experiences and severity of condition. And sometimes hearing about those other experiences can help you acknowledge the shared humanity and be kinder to yourself. We also have a peer mentorship program where we pair up a mentor and a mentee with a similar condition. But there are lots of other ways outside of our organisation that you could find your own community who are supportive and make you feel less alone. I like this one, to-do lists and not to-do lists. So rather than writing down all the things that you need to do and ticking them off one by one as you go throughout the day, and then sometimes ending the day with a whole bunch of tasks that you haven't completed, you can write down things that you've done or achieved over the course of the day on a to-do list. Often we don't give ourselves enough credit for what we're actually still managing to do when we're unwell or we're not at our previous capacity. And when we give ourselves credit for what we are actually doing, then we're less likely to be self-critical. So in the same vein, I'll talk a little bit about Club Tortoise at the end of the presentation, but we have a little weekly wins post in our Club Tortoise Facebook group where people are able to write about anything that they're proud of from that week, whether that's to do with their condition or not, and whether that's big or small. There's a technique from acceptance and commitment therapy called cognitive diffusion. And cognitive diffusion just means distancing yourself from an automatic thought that comes up, especially negative ones. And a really good way of doing that is giving your inner critic a name. So for instance, I might be in a foul mood and lots of negative thoughts are coming up about myself. And I might label my inner critic Jeremy. And when a thought comes up like, you're such a burden, I can say, "Oh, be quiet, Jeremy. I don't appreciate your negativity." And that can kind of create a bit of distance from that thought, make yourself laugh a little bit even. Another technique is scheduling pleasant and fulfilling activities. So when you're able to increase your positive emotions and find fulfillment in activities throughout your day or throughout your week, you're less likely to get stuck automatically in that self-critical space. So a couple of strategies could be making time for pleasant activities through your week, like crafting, or walking outside in nature. If you can't walk, sitting outside in nature, getting yourself a coffee at your favorite coffee shop. And another one could be connecting to something greater than yourself. So that might be a spiritual or religious practice if you are spiritual or religious, or just spending time in groups or with people who you get a lot of joy and uplift you. And another really powerful tool can be tweaking that inner dialogue from self-critical, and that might look like treating your body or any big emotions like a young child you're looking after. Children can have some pretty violent tantrums, but it's not their fault. We don't blame them for those sorts of things. So instead, you could treat your body like a child having a tantrum, and you could say, I can see you're stressed, and that's okay. What do you need to feel better and safe? Don't worry, I'll look after you. Another strategy could be to really focus on validating yourself. Often our first instinct is to think that we're weak or for not being able to control our emotions. Or sometimes we can just keep trying to push through hard situations. But pushing down valid emotions actually can make them even bigger, even if they're uncomfortable. So you could instead say to yourself, it's no wonder I'm feeling unwell or tired or upset. I'm dealing with a lot right now. Anyone else in this situation would feel the same way, and I'm doing a good enough job. And finally, a favorite of mine is just to occasionally check in with how I'm feeling and just being kind of mindful about the sensations and the emotions that are going on for me at that moment, and see if there's any little behavioral adjustments or things that I can do to give my body or mind what it could need to feel better in this moment. So sometimes it can be helpful to use this technique as part of a routine in the morning after getting out of bed, and just to sit for a moment and ask yourself, um, what is it that my body or mind need today? What is one little thing that I could do that could help me feel better today? Now, we've just got a short video here summarizing self-compassion before we finish up.
Have you ever felt that warm tug in your heart when you see someone who's hurt or having a tough time? That's compassion, a wish to be kind, accepting, and supportive towards others. Although I can be good at showing compassion to others, I've discovered something pretty cool lately. It's called self-compassion, and it's all about treating myself with kindness and understanding, just like I would treat a dear friend in need. Now, I'll be honest, self-compassion doesn't come that naturally to me. Sometimes I say some pretty mean things to myself before I even realize it. I wouldn't want someone else to talk to me the way I talk to myself sometimes, especially when I'm already feeling low. So on my journey to learn more about self-compassion, I stumbled upon something interesting from Dr. Kristen Neff. She talks about 3 important parts to self-compassion: mindfulness, self-kindness, and recognizing our shared humanity. Let's break that down a bit, starting with mindfulness. It's about paying attention to how I'm feeling, whether it's sadness, frustration, or another tough emotion, without judging myself for it. It's like taking a step back, naming what I'm experiencing, and realizing that feelings will always come and go, and that's okay. After I notice I'm having a tough time, the next step is about self-kindness. Instead of being hard on myself when I mess up, I'm learning to be gentle and supportive, just like I would be with a friend who's going through a rough time. It's about treating myself with the same care and desire to help that I'd offer to someone I love. And finally, recognizing our shared humanity. This one's important. It's about remembering that everyone experiences tough times, setbacks, and moments of imperfection. It's part of being human. Knowing this helps me to feel less alone in my struggles and more connected to others. Putting it all together, when I'm struggling now, I try to notice it and bring a kind attitude to myself. This is tough, and other people would feel this way too in this situation. I try to be gentle with myself and to give myself what I need right now. Next time you're facing a setback or feeling low, why not give yourself a little dose of self-compassion? Trust me, you deserve it. And hey, if you want to learn more about self-compassion, check out the links below.
Okay, so where to from here, how can our organization help you to build your self-compassion muscle? So I guess the first one is, again, that aspect of shared humanity. We've got a number of support groups for a variety of different conditions and focuses. Some of them meet monthly, some of them meet weekly. We've got a rheumatoid arthritis and Sjogren's group who meet monthly in person. We've got the ME, chronic fatigue syndrome, fibromyalgia, long COVID, and persistent pain. We've got a weekly online catch-up via Zoom, and we've got monthly cafe catch-ups there as well, which have been really well attended recently, which is very nice. There is a young women's autoimmune friendship group available via Facebook online. We've got the Lounging Lizards group for young people who've got fatiguing and pain conditions, and they meet on Wednesdays via Discord. And then there is also the knitting and crochet groups through Arthritis ACT as well, who meet weekly. We've also got this structured support group for people who want to learn pacing skills and self-management skills for people who've got fatiguing and pain conditions. And in those groups, there is a focus on validation and self-compassion as well. So that program is called Club Tortoise, and we're currently running 2 concurrent groups who meet via Zoom on Tuesday evenings and Thursday mornings, and we've got a private Facebook group as well. I forgot to mention, all of these services are free for members. And we've also got a 9-week course for, it's like limited to 8 participants to learn other self-management, symptom management, and stress reduction strategies for people who experience fatigue and pain conditions, and they're led by facilitators with lived experience. The next intake is for late October, and we do keep a wait list. So if you're interested in that, just contact me. I'll pop you on the wait list, and we'll contact you as soon as we open up enrollments for that one. I think that one's free for members, and there is a cost for non-members. So you can contact the Emerge ACT team for more details on all of those services. The best way to contact us is via the email address mecfs@arthritis.act.org.au, or you can call this number and that will put you through to reception, and they'll leave us a message and we'll get back to you if we're not available. Otherwise, we've also got a number of free resources, so information sheets and videos and things that are linked via our website as well, emergeact.org.au. And on that, we have 2 other upcoming free talks this year that are kind of under the Club Tortoise umbrella. So we've got another one which I think will be very helpful for people practicing self-compassion. That will happen in October, the Respecting New Limits. So if your capacity changes, respecting those new limits. And that will be delivered by Leanne. And Leanne will also be presenting Surviving Christmas and the holiday period when you've got a chronic illness as well, and that'll happen in November. So those are all the resources that I used for this presentation. If you do want a copy of that slide with all the links, just let me know. I can send that to you. But I just wanted to leave you with a quote that from a newsletter that I actually received this morning. So this was a last minute addition. And this was from the Center for Mindful Self-Compassion in the US, that was founded by Kristen Neff, who is one of the main researchers in the self-compassion space. And this quote is, there was a bit of an essay written by Elijah Zimmerman in the newsletter, who is the director of the center. And I'll just read this out. In a world that asks us to lead at full throttle, to perform, to produce, and to be exceptional at all times, it's easy to forget that we're already leading. We lead in our families, in our friendships, in our workplaces, and within ourselves. Leadership isn't just about titles or visibility. It's about how we show up with presence, with intention, with care. And perhaps more than ever, leadership today is asking not just for excellence, but for humanity. That means respecting limits, our own and those of others. It means making space to rest, to not know, to get it wrong and begin again. It means learning to lead with courage, with candor, and with softness. Self-compassion is not a luxury in times of change. It is a vital resource. It allows us to acknowledge when things are hard without turning against ourselves. It invites us to notice what we are feeling, to offer ourselves warmth, and to remember we are not alone in any of this. Okay, well, that is the end of my presentation. We might take a 2-minute break, and then if anybody has any questions, feel free to come off mute or write them in the chat and we'll chat about those. I'll just stop the recording. Oop, can work out how to do this.